Let's start about ECG from Davidson's. The electrocardiogram is used to assess cardiac rhythm and conduction. It is the main test used in the diagnosis of myocardial ischemia and infarction. First of all, we have to get clear idea about ECG graph paper. This is typical ECG graph paper. Each small square represents 0.04 second in time, 1 millimeter in height and 0.1 millivolt in amplitude. The vertical axis measures the amplitude of the heart's electrical current. It is measured in millivolt. 1 millivolt equal to 10 millimeter, and so 1 millivolt requires 2 large squares. There are 12 leads generated from 10 physical electrodes. 3 dipole lymph leads, lead 1, lead 2, lead 3, 3 augmented voltage lymph leads, AVR, AVL, AVF, and 6 chest leads, V1, V2, V3, V4, V5 and V6. The right leg electrodes acts as a earthing electrode. Depolarization towards electrode, positive deflection. Depolarization away from electrode, negative deflection. Here we see heart rate calculation equation. Later we will discuss it. Now come to components of an ECG. There are 3 main components to an ECG: POF, QRS complex and TOF. If we want to understand this OF, we need to know cardiac conduction system. This figure shows cardiac conduction system. This SA node, this AV node. When SA node fire, it produces POF, indicate atrial depolarization. When AV node fire, it produces QRS complex and indicate ventricular depolarization. Tall POF due to right atrial enlargement and known as P pulmonale. Notched POF denote left atrial enlargement and called P mitrale. This tall POF and this notched POF. Now come to PR interval. This black line PR segment and this PR interval from the beginning of POF to the beginning of QRS complex. Normal PR interval 0.12 to 0.20 second. Prolongation denotes impaired AV nodal conduction. And short PR interval occurs in Wolff-Parkinson-White syndrome. Now come to QRS complex. Normal QRS complex 0.1 second in white. If more than 0.12 second, ventricular conduction is abnormal, and if it may be left or right bundle branch block. In right bundle branch block, lead V1, V2 show white QRS complex. In left bundle branch block, lead 1 show white QRS complex. When we think QRS complex in amplitude, large QRS complex occur in slim young patient and in patient with left ventricular hypertrophy. Now ST segment. For ST segment we have to see another figure. This is ST segment. Just from end of QRS complex to the beginning of T wave. ST elevation occurs in myocardial infarction, pericarditis, left ventricular aneurysm, etc. ST depression also occurs in myocardial infarction. Here figure B show ST elevation in myocardial infarction. Now come to T wave. T inversion occurs in congenital QT syndrome, hypokalemia, hypomagnesemia, hypocalcemia, and some drugs. Here figure D show T inversion in transmural myocardial infarction. Let's start about cardiac axis. In normal cardiac axis, QRS complex positive in lead 1 and lead 2. In left axis deviation, QRS complex positive in lead 1 and QRS complex negative in lead 2. In right axis deviation, QRS complex negative in lead 1 and positive in lead 2. Thanks for watching. This is summary. Thank you.